So now we are going to see about extensor muscles of the forearm region. We have completed about the anterior compartment or flexor compartment of forearm. Now we are going to deal with extensor compartment. So extensor compartment, here you can make out all these things what we seen as anterior compartment muscles. Here in the lateral aspect you can see two muscle in the anterior aspect only. So those muscles are nothing but extensor muscles. So that is, here we have one muscle called brachioradialis. Name itself indicates it is coming from the brachium region and getting related with radius. So we are calling that as brachioradialis muscle. Altogether, in extensor compartment, we have around 12 muscles such as superficial and deep layer. In superficial layer, we will be having 7 muscles, and in deep layer, we will be having 5 muscles. So first talking about the superficial layer muscles, first muscle what we are seeing is brachioradialis, which is seen in the lateral aspect. So this is brachioradialis muscle. Just lateral to this brachioradialis, another muscle you can see. So a small part you can make out, that muscle is nothing but extensor carpi radialis longus. So these are the two muscles you can view their part in the anterior aspect. So other muscles we are going to see in the posterior view. So in the posterior view we are going to see other muscles such as remaining of the 7 muscles, that is 5 muscles will be seen properly in the posterior aspect. So posterior compartment, first muscle what you are seeing is extensor carpi radialis longus. So here you can see small part of the brachioradialis also, which we seen before. So this is brachioradialis, and behind that or lateral to that we have another muscle, that is extensor carpi radialis longus, and then lateral to that again we can make out. So this is laterally placed, and then if you are coming from lateral to medial aspect, you can see other muscles seen here. So that is related to extensor carpi radialis longus, we will be having extensor carpi radialis brevis. So after extensor carpi radialis brevis, we will be having another muscle which we will call as right extensor digitorum. So extensor digitorum is the fourth muscle which you are seeing in the extensor compartment. First muscle what we seen is brachioradialis, then we will be having extensor carpi radialis longus, along with that we will be having extensor carpi radialis brevis. The naming of these muscles you can understand once origin and insertion is clear to you. Now for orientation, just go through the 3D image of these muscles. So after extensor carpi radialis brevis, the muscle which we will see in posterior aspect is extensor digitorum, which is going for digits, and then we will be having another muscle related near to the extensor digitorum, that is going to the little finger. So we are calling that as extensor digiti minimi muscle. So extensor digiti minimi, it is going to the medial side, and then lateral to that again we will be having, it is medial to that we will be having another one more muscle that we will call as extensor carpi ulnaris. So it is most medially placed extensor muscle, that is extensor carpi ulnaris. So altogether we have 6 muscles now. Another one more muscle you can view here, that is nothing but anconius muscle. So these are the muscles which are going to form superficial layer of extensor compartment of forearm. So I will repeat those muscles again. First muscle is brachioradialis, then we will be having extensor carpi radialis longus along with extensor carpi radialis brevis, and then we will be having extensor digitorum, then we will be having extensor digiti minimi along with extensor carpi ulnaris and anconius. So altogether we will be having around 8 muscles such as brachioradialis and till anconius. We will be having altogether 8 muscles in our extensor compartment superficially. And now we will go on to the deeper layer muscles. So if we are going to deep layer muscles, we will be having 5 muscle in its arrangement. So 5 muscles what we are going to see is, So in superficial aspect we had seen 7 muscles. Now we are going to see deeper muscles such as 5 in number. So those deeper muscles to approach we have to remove the superficial muscle. So I am removing extensor digitorum along with extensor digiti minimi and extensor carpi ulnaris. So if you remove all these muscles you can make out some other muscles present here. Okay, so these superficial muscle also we will remove, then it will be easy for us to understand the extensor group. So now talking about extensor muscles deeper group, we will be having first muscle just below the anconeus as supinator. So this is the first muscle which is seen from above downwards and the deeper layer, that is supinator muscle. Name itself it indicates it is going to give an action called supination. And then after below supinator muscle we will be having abductor pollicis longus muscle. So the muscle which is going to abduct the thumb finger, and we have a name called abductor pollicis longus muscle. And then below that we will be having another muscle which we will call as extensor pollicis brevis. So here you have to remember a mnemonic brevis between two longus. We have these three muscles always going together, that is extensor pollicis brevis will be middle, and above that we will be having abductor pollicis longus, and below that we will be having extensor pollicis longus. So these two longus, between these two longus we will be having a muscle called extensor pollicis brevis. So these are the four muscles which we seen in the deeper layer. One is supinator, extensor abductor pollicis longus, extensor pollicis brevis, and extensor pollicis longus. And one more muscle what you are seeing here is extensor indicis, the muscle which is going to index finger. So these are the 5 muscles which is seen in the deeper group of forearm posterior compartment. So altogether we have 12 muscles, so 7 muscles superficially and 5 muscles in the deeper aspect. To know about the detailed features of these muscle, about its origin, insertion, nerve supply and its action, we will go on to the detailed procedure or detailed description of its particular topic. So in this class we are going to see detailed account of back of the forearm, that is posterior compartment of forearm region. So as we already seen, we have in forearm posterior compartment around 12 muscles, and that also we are dividing into 7 superficially and deep 5 muscles. Along with these muscles we will be having some other structures also. So about those also we are going to see in this class. So talking about the posterior compartment of forearm. So overview, the things we are going to cover in this topic are muscles of the posterior compartment, and about the extensor retinaculum, nerves and vessels of the back of forearm along with applied aspects. So now moving on to muscles of the posterior compartment. So muscles of posterior compartment, as I said, it is divided into superficial and deeper group. Superficial group we will be having around 7 muscles. So first muscle what we will be seeing is brachioradialis, second is extensor carpi radialis longus, and third is extensor carpi radialis brevis. And then we will be having extensor digitorum along with extensor digiti minimi and also extensor carpi ulnaris. So these muscles are arranged from lateral to medial aspect. Along with these muscles near to the elbow joint posteriorly we will be having another muscle called anconeus. So altogether these are the 7 muscles which are going to form superficial layer in the posterior compartment of forearm. Now we are going to see deep group muscles. So deep group muscles are 5 in number, and first muscle is supinator muscle. We already dealt with this muscle in cubital fossa, which is forming the floor of the cubital fossa. So along with supinator we will be having abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and then we will be having extensor indicis. So these are the 5 muscles which are going to form deep layer in the extensor compartment. So about the details of these muscles we are going to learn now. So first we are going to deal with superficial group muscle. So first muscle in that is brachioradialis. Coming for the origin of brachioradialis, as the name itself it indicates, brachio, in the sense it is going to take origin from the arm bone, that is humerus. So upper two-third of the lateral supracondylar ridge of the humerus. So first thing you have to remember is whatever muscle it may be, you have to know a thorough knowledge of bones first. So if you are well known with bones and their features, then it is very easy for you to remember all the attachments and all. Otherwise it will be vague for you to remember these names. So now for brachioradialis, in humerus we will be having lateral supracondylar ridge in the lateral area, and the upper two-third of the lateral supracondylar ridge of humerus along with the lateral intermuscular septum are going to give origin for brachioradialis muscle. And now talking about insertion, it is going and inserting in the radius, so we are getting the name brachioradialis. So insertion, it ends by a tendon which is inserted into the lateral side of the radius. In radius, it is attaching just above the styloid process. Here you can make out that one. So this is the insertion of the tendon of brachioradialis, which is getting inserted in the radius above the styloid process. Now talking about its nerve supply, this muscle is supplied by radial nerve. So your almost posterior compartment muscles are supplied by radial nerve. So here also the major trunk of the radial nerve, it is supplying this brachioradialis. And the action of this muscle is flexor of the forearm, and it is acting best when the forearm is in mid-prone position. You know all these positions, so if you are thorough with general anatomy, these things are familiar for you. So flexor of the forearm, and also it is acting best when the forearm is in mid-prone position. So here you have to remember, usually posterior compartment we will call as extensor, because the main action of this muscle is extension. But here brachioradialis is an exception. It is a flexor muscle. It is used in the level or at the action of mid-prone position of the forearm. Now talking about other muscles, all other muscles are extensor in function. So first muscle we are going in such a way is extensor carpi radialis longus, which is medial to the brachioradialis muscle. So this extensor carpi radialis longus, it is taking origin from lower one-third of the lateral supracondylar ridge of the humerus. So here you can make out, this is humerus bone, this is the lateral one-third, so lateral supracondylar ridge. In the lower one-third of the lateral supracondylar ridge of humerus, we have this muscle taking origin, and then insertion, it is happening in the carpal bones along with metacarpal. So origin, it is happening in the lower one-third of lateral supracondylar ridge and along with common extensor origin, that is lateral epicondyle, and also in the lateral intermuscular septum, and insertion happening in the lateral side of the base of second metacarpal bone. So this is first one, second, third, fourth and fifth metacarpal. Here we have second metacarpal bone. In the base of the second metacarpal bone, we have the insertion of this particular muscle. It is crossing the carpal bones and then it is reaching the base of second metacarpal. So origin, it is from the lower one-third of lateral supracondylar ridge of humerus and also from the lateral epicondyle and then from lateral intermuscular septum. Insertion happening in the lateral side of the base of second metacarpal bone. Talking about its nerve supply, again this is also supplied by radial nerve, which is carrying fibers of C6 and C7. And talking about its action, extension of the wrist, abduction of the wrist, and assist movements of the digits by fixing the wrist. So it is crossing the wrist joint. So whatever action is happening, that is happening towards the for the wrist region. So extension of the wrist is happened by this abduction of the wrist along with the assisting movements for the digits by fixing the wrist in position. So these are about the details of extensor carpi radialis longus. Now we will move on to the paired muscle, that is extensor carpi radialis brevis, which is the smaller muscle compared to extensor carpi radialis longus. So these two always comes together. So talking about this muscle, origin of this muscle is taken from again humerus. In humerus we have extensor origin happening from lateral epicondyle. So lateral epicondyle of humerus along with radial collateral ligament of elbow joint, these both giving origin for this particular muscle, and the insertion happening same like the before muscle. By crossing the carpal bones, it is getting inserted in the dorsal aspect of the base of second and third metacarpal bone. There we studied it is in the second metacarpal bone, and here it is getting inserted in the second and third metacarpal bones. So that's all about the details of extensor carpi radialis brevis. It is taking origin from lateral epicondyle, inserting in the second and third metacarpal bones base. And talking about the nerve supply, it is by a branch of radial nerve, that is deep branch of radial nerve. So I will explain you about the nerves detailedly later. Now you remember the nerve supply for this muscle is deep branch of radial nerve, which we otherwise called as posterior interosseous nerve, carrying fibers of C7 and C8. Seeing the action of this muscle, the action of this muscle is especially extension and abduction of the wrist joint. So the major action for this brevis muscle is extension and abduction of wrist. Now we will move on to another muscle which is present medial to this brevis muscle, that is extensor digitorum. You may remember in flexor compartment we studied flexor digitorum superficialis and flexor digitorum profundus separately. Here no such variation will be seen. For the digits we have one muscle on a bulk. That muscle we will call as extensor digitorum. So this extensor digitorum, it is taking origin from lateral epicondyle as like other muscle. From the lateral epicondyle of humerus it is taking origin and getting inserted by dividing into 4 tendons. You can make out here. So by dividing into 4 tendons, it is getting inserted in the phalanx of the dorsum side of hand. So here on the proximal phalanx, each tendon receives its insertion, and then the the extensor digitorum is also getting insertion of lumbricus muscle along with interosseous muscle to form dorsal digital expansion. So this thing you have to remember. This muscle, it is dividing into 4 tendons and then it is getting inserted into the phalanges. So on the proximal phalanx, each tendon of this extensor digitorum is receiving its insertion of lumbricus muscle along with interosseous muscle to form dorsal digital expansion. And talking about its nerve supply, this is again supplied by deep branch of radial nerve, that is posterior interosseous nerve, which is carrying fibers of C7 and C8. Then we will be having some actions carried by this muscle, that is extension of interphalangeal joint and metacarpophalangeal joint. Along with that, extension of wrist also happening in this muscle, by this muscle. So we will be having nerve supply and action of extensor digitorum in such a way it is going and inserting in phalanges. So for the interphalangeal and metacarpophalangeal joint, it is making extension along with, because it is crossing the carpal bones, it is also going to form extension in the wrist joint also. Now we will move on to our next muscle which is present medial to this extensor digitorum, that is extensor digiti minimi. So this muscle name itself, it indicates it is going to the little finger. So we are calling it as digiti minimi. This is also taking origin from common extensor origin, that is lateral epicondyle of humerus, and insertion is happening in the dorsal digital expansion of 5th digit. So as this muscle is going to give an action in the little finger, the insertion is also happening in the little finger, that is into the dorsal digital expansion of 5th digit. Now we will move on to its nerve supply. The nerve supply is the branch of radial nerve, posterior interosseous nerve, carrying C7 and C8 fibers. The action of this muscle is extension of little finger and the wrist joint. Talking about the another muscle which is present medial to this muscle is extensor carpi ulnaris. So this muscle taking origin from again lateral epicondyle of humerus and also from posterior border of ulna by a common aponeurosis. That's why we are calling it as ulnaris muscle. So extensor carpi ulnaris taking origin from lateral epicondyle and also from the posterior border of ulna by a common aponeurosis. The insertion is happening in the styloid process of fifth metacarpal bone, that is in the ulnar side near to the little finger we have fifth metacarpal bone. So in the fifth metacarpal bone we will be getting a styloid process near to the base. The styloid process of fifth metacarpal giving insertion for this particular muscle called extensor carpi ulnaris. Talking about its nerve supply, it is supplied by deep branch of radial nerve, that is posterior interosseous nerve, which is carrying fibers of C7 and C8 spinal nerves. Action of this muscle is extension of wrist. So this is the major function. Along with that, it is going to give adduction of the wrist. So extension and adduction of wrist are the major function of the extensor carpi ulnaris. So the other more muscles, so 6 muscles got over. The remaining one muscle which is present posterior to the elbow joint is anconeus. So this muscle taking origin, while seeing in picture only you can make out it is a triangular muscle. So you can make out here. So it is a triangular muscle. The origin of muscle takes origin from again lateral epicondyle but from the posterior aspect. So from the posterior aspect of lateral epicondyle of humerus we have this origin of anconeus muscle. The insertion is happening in the lateral aspect of the olecranon process of the ulna and also in the upper 1/4 of its posterior surface. So origin from the posterior aspect of lateral epicondyle of humerus, insertion in the lateral aspect of olecranon process of ulna along with upper 1/4 of its posterior surface. Talking about its again nerve supply. Nerve supply by nerve to anconeus, a branch of radial nerve itself. In the spiral groove, it is giving one branch separately for anconeus muscle which is carrying fibers of C7, C8 and T1, and the action of this muscle is it is a weak extensor of the elbow joint. As it is related to elbow joint, it is again forming extension, helping in the extension, but it is a weak extensor of the elbow joint. Now superficial group of muscles got over. So altogether we seen 7 muscles, and now we are moving on to detailed account of deep groove muscles, that is which are 5 in number. First muscle which we are going to see is supinator muscle. So in the name itself it indicates it is the major muscle for supination action. So this muscle it is taking origin from again lateral epicondyle of humerus and also from radial collateral ligament of the elbow joint and also annular ligament also giving origin for this particular muscle along with supinator crust of ulna. So the origin we have 4 in number. So from 4 areas this muscle is taking origin, that is from lateral epicondyle of humerus and another thing from radial collateral ligament and also from annular ligament along with supinator crust of ulna. This muscle it is getting inserted in the upper 1/3 of the lateral surface of radius. Here you can make out. So it is taking origin from the upper part and also from the annular ligament and the radial collateral ligament. Later it is moving downwards and reaching the upper 1/3 of the lateral surface of the radius and getting inserted. So then knowing about the nerve supply, it is also supplied by deep branch of radial nerve, that is posterior interosseous nerve which is carrying C7 and C8 fibers. The action, as you know by the name itself, it is supination of the forearm. Now talking about the next muscle, we have abductor pollicis longus. Name itself it indicates it is responsible for abduction of pollicis finger, and it will be there. We have another muscle which is smaller and doing the same action, that is brevis, which we will deal later. So this muscle which compared to that muscle it is longer, so we are calling it as abductor pollicis longus. Talking about the origin, it is taking origin from middle 1/3 of the posterior surface of shaft of radius. So this is the radius bone and from the shaft of radius it is taking origin. And then from the middle one third and also from the lateral part of the posterior surface of ulna. So here we have the origin, taking origin from middle one third of the posterior surface of radius and also from the lateral part of posterior surface of the ulna along with adjoining part of interosseous membrane. So between the radius and ulna we have a membrane, as you know, that is interosseous membrane. Interosseous in the sense between the bone. Osseous means bone. So interosseous membrane is also giving the origin for this particular muscle. So three origins are there from the posterior aspect of middle one third of the radius and also from posterior surface of ulna and also from interosseous membrane. Talking about insertion, it is getting inserted in the lateral side of the base of first metacarpal. You know, it is a pollicis muscle. So it have to get inserted in the pollicis metacarpal. So first metacarpal bone base is giving insertion for this particular muscle. Now talking about nerve supply. The nerve supply of this muscle is again deep branch of radial nerve, which otherwise known as posterior interosseous nerve, carrying C7 and C8 fibers. Action of this muscle, as I said before, major function is abduction and also extension in the first carpo-metacarpal joint, that is between the carpal and metacarpal bone we will be having a joint. That joint in the first place, that is in the lateral side, first carpo-metacarpal joint abduction and extension is done by this particular muscle. Talking about the next muscle, we have extensor pollicis brevis along with extensor pollicis longus. So first muscle what we are going to see is extensor pollicis brevis, extension of pollicis finger, and it is smaller in size, so we are giving a name called brevis. Origin of this muscle is from posterior surface of the shaft of radius below the origin of abductor pollicis longus and also taking origin from interosseous membrane also. So just now we have seen origin of abductor pollicis longus from the posterior aspect of radius. So just below that we will be having some area of the radius left over. So that is giving origin for this particular muscle along with the adjoining interosseous membrane, and the insertion is happening into dorsal surface of the base of proximal phalanx of thumb. There we seen it is going to the metacarpal joint, metacarpal bone, base of first metacarpal bone. Here it is going to the proximal phalanx of the thumb finger. Then it is getting inserted in that place, and so nerve supply of this muscle is again the same branch as the branch of radial nerve, and in action will be extension of first metacarpophalangeal joint and carpo-metacarpal joint. There we had seen extension and abduction of carpo-metacarpal joint. Here it is crossing the metacarpophalangeal joint also. So we have two action happening in two joints, that is extension happening in metacarpophalangeal joint and carpo-metacarpal joint. Talking about extensor pollicis longus. Extensor pollicis longus along with extensor pollicis brevis it will be seen, and it will be having a lengthwise larger compared to brevis, so we are calling it as extensor pollicis longus. And the origin of this muscle, it is taking origin from lateral part of posterior surface of the ulna and here adjoining part of interosseous membrane. Therein for brevis it is taking origin from radius, here it is taking origin from ulna along with adjoining interosseous membrane. Insertion is happening in the base of distal phalanx of the thumb finger on its dorsal aspect. The brevis muscle, it is getting inserted into the proximal phalanx, here it is getting inserted into the distal phalanx of the thumb on its dorsal aspect. The nerve supply of this particular muscle is same like the previous muscle, that is deep branch of radial nerve, posterior interosseous nerve, which is carrying C7 and C8 spinal nerves. The action again extension of interphalangeal joint also along with carpo-metacarpal joint of thumb region. Along with that it will be having action in thumb, that is adduction and lateral rotation of thumb. So these are the actions of extensor carpi extensor carpi radialis. So these are the actions of extensor pollicis brevis. So extensor pollicis longus, and now we are going to deal with extensor indicis. So origin of this muscle, it is happening from posterior surface of ulna just below the origin of extensor pollicis longus, and also from the adjoining part of interosseous membrane. Insertion into the medial side of tendon of extensor digitorum to the index finger. So this muscle, it is going to give action in the index finger. So the tendon of this muscle is getting inserted into the index finger near to the extensor digitorum tendon, and then nerve supply of this muscle is again same deep branch of radial nerve. Action will be extension of index finger and the wrist joint. Talking about extensor retinaculum, so which is present in the dorsum of the hand. So all these tendons which we are seeing are muscles which are 12 in number, and all these muscles are giving its tendon near to the dorsum region of the hand. So all these tendons whichever we are seeing are going to pass below this retinaculum. Retinaculum means nothing but it is a thickening of deep fascia, and here in the extensor compartment we are seeing extensor retinaculum. Same way before classes we had deal with flexor retinaculum. So now we are going to see extensor retinaculum in detail. So here it is present is, it is seen in the back of wrist joint and in the lower part of forearm. The shape of the extensor retinaculum is quadrilateral in shape, and then the direction will be downwards and medially placed. Along with that, talking about its attachment, lateral and medial attachment we are dividing. Lateral attachment, it is happening in the lower part of anterior border of the radius bone. So lower part of anterior border of radius bone giving lateral attachment. Medial attachment, it is happening in the styloid process of ulna along with triquetral and pisiform bone. There in flexor retinaculum the attachment is happening in the carpal bones alone. Here it is happening in radius and ulna also along with the carpal bones which are present medially. And now talking about the arrangement. So arrangements, if you are talking, we are dividing the extensor retinaculum into septas. So 5 septas to give 6 compartments of extensor tendons. So this from the extensor retinaculum in the deeper surface we will be having some septas arising which is going below to divide the compartment or divide the area into 6 compartments by means of its 5 septas. So by dividing in such a way from lateral aspect to the medial aspect we have 6 compartments formed by 5 septas. So these are the septas arised from the extensor retinaculum. So laterally we will be having first septum, first compartment which is carrying tendon of abductor pollicis longus and extensor pollicis brevis, and in the second compartment we will be having extensor carpi radialis longus along with extensor carpi radialis brevis. So all these are not muscles, the tendon of these muscles are going to pass through these compartments, and in the third compartment we have only one tendon, that is extensor pollicis longus tendon. In the fourth compartment we will be having muscles along with vessel and nerve. So muscles we have our extensor digitorum, extensor indicis, and then we will be having vessels such as posterior and anterior interosseous vessel, and nerve is posterior interosseous nerve which is a deep branch of radial nerve. So the tendon of two muscles is extensor digitorum and extensor indicis, nerve is posterior interosseous nerve, vessel is anterior and posterior interosseous vessel. And in the fifth compartment we will be having tendon of extensor digiti minimi passing, and lateral or medial to it we will be having the sixth compartment that is going to transmit tendon of extensor carpi ulnaris. So these are the septas and the compartments made by extensor retinaculum for the passage of tendons of extensor compartments. So the extensor compartment muscles, if you are thorough with it, these things also, it will be easy for you to remember. So talking about extensor retinaculum. This is an image. In the dorsal aspect it is present, and you can see it is quadrilateral in shape. And so this is lateral aspect and this is medial aspect. Lateral aspect it is taking origin from radius part, and medial aspect it is getting inserted into the lower part of ulna, that is styloid process, along with carpal bone sides, that is tricutril and pisiform bone. It is giving attachment in the medial aspect. So below this you can make out these tendons. So this is tendon of extensor digiti minimi along with extensor carpi ulnaris. So this is extensor carpi ulnaris along with extensor digiti minimi, and here we will be having extensor digitorum along with extensor indicis, and here we will be having extensor pollicis longus and brevis tendons, which will be clear in a cadaveric view. Here you can see only an overview of some tendons passing. You can't make out clearly in this picture. So if you are seeing in cadaver, all these tendons which we are discussed are very clear for you to see. And these are the images which is representing the extensor retinaculum compartments. So this is lateral most part, this is medial part. All the 6 compartment is shown. In first 2 compartment we will be having only two tendons. In the third compartment we will be having only 1 tendon passing, and in the fourth compartment we will be having 2 tendons along with vessels and nerves. So fourth compartment is very important to remember. And then we will be having fifth compartment transmitting again 1 tendon, that is extensor digiti minimi. In the sixth compartment we will be having extensor carpi ulnaris tendon. So here also you can make out those structures clearly. So talking about nerves and vessels of the back of forearm, we will be having posterior interosseous artery, which is a terminal division of common interosseous artery. This common interosseous artery is again a branch of ulnar artery, which you know already, and this posterior interosseous artery descends between the superficial and deep groove muscles of posterior compartment, and at last it ends in dorsal carpal network. So it is by forming dorsal carpal network it will end off. So that's all about posterior interosseous artery you have to know. Talking about the nerve, we have posterior interosseous nerve. As I said before, it is a deep branch of radial nerve and it is carrying C6, C7 and C8 nerve fibers. It is piercing the supinator muscle and coming out. The deep branch of radial nerve, it passes in the facial plane between the superficial and deep extensors. Later it is going to supply motor innervation for all the muscles, almost all the muscles of the posterior compartment of the forearm region. So this is the nerve which you are seeing, posterior branch, that is deep branch, which is going to supply whole of the posterior compartment. So this is the path of radial nerve, how it is coming and how it is giving its branches. So wrist drop, it is a condition which is formed, it is due to the injury in the radial nerve, and it is causing paralysis of the extensor muscles of the wrist and fingers, which is causing the hand to hang down at the wrist joint as shown in the picture. It is mainly caused by the injury to radial nerve. The long extensors of the forearm are paralyzed by in this condition, and which is going to result in this wrist drop, and there is a small loss of sensation over the dorsal surface of the hand also. Along with the injury to the tendons, it is going to give some loss of sensation in the dorsal aspect in the lateral part of the hand. And then talking about another applied aspect related to this is lateral epicondylitis, which is otherwise known as tennis elbow. Here what will happen is lateral epicondylitis, it is a result from inflammation and micro tearing of fibers in the extensor tendons of the forearm. You know, most of the extensor tendons are taking origin from lateral epicondyle of humerus. While taking origin in that part, they will be having the tendons of this, or the ligaments are related to the muscle where it is taking origin, no? So those fibers, muscle fibers, will undergo some tearing, micro tearing happening in these fibers, or some case we will be having inflammation happening in here. So that condition we will be having tennis elbow. So mostly it is happening in tennis players hands, so we are calling it as tennis elbow. The actual name for this is lateral epicondylitis. So here you can see images. So this is a healthy person's lateral muscles, and here we can make out some teared areas or inflammation in the tendons where it is taking origin. So this condition is happening in lateral epicondylitis condition. So that's all about the details of posterior compartment of forearm. You have to know the remaining details we will deal later. Now we will move on to palm region or hand region, where we are going to deal with palm and dorsum of hand separately.